For many children, there's been an increase in terms of their mental distress. So they're really struggling.
The pandemic is having a severe effect on children. With the absence of things like school and social lives, new data showing that suicide, drug use, abuse, and an overall poor quality of life is increasing in youth. Dr. Sherry Madigan is an associate professor in psychology at the University of Calgary. She says isolation is afflicting younger generations at a time when they're less developmentally able to cope.
They don't have routines necessarily anymore, and they're in isolation. And we know that social isolation is strongly linked to mental distress.
Suicide attempt admissions have increased by 100% among children and youth during the pandemic, according to Children's Healthcare Canada. Substance use disorders have tripled since last year, opioids being part of that. Abuse admissions in children are climbing. The number of infants being treated for fractures and head trauma has gone up by 100% since September of last year. And according to the BC Children's Hospital, there have been spikes in nutritional neglect and starvation.
Parents and families are under significant stress right now, economic, emotional, and they're really struggling with the social isolation that their children are as well. And unfortunately, sometimes that comes out in abuse.
Kimberly Moran is the CEO of Children's Mental Health Ontario, where in some parts of that province, children have been without school or activities for up to 5 months. That's part of why Children's First Canada is declaring Code Pink, a term used for pediatric emergencies. Advocates are calling for greater measures to control spread so children can get back to their normal lives.
We shouldn't see retail establishments or other non-essential businesses open before schools open because our kids' mental health is really at risk.
And so we really are urging leaders at all levels to work together to ensure that children can return to school as quickly and as safely as possible.
Code Pink is also calling for more accessible mental health supports with less wait time. Madigan says this help for children can't come soon enough.
We need to start integrating policies now and make services available to them now so we can help them in this more immediate time of the pandemic.
In Calgary, Taylor Braat, City News.